Welcome to the Green Wisdom Health Show.
You know, the real question I ask, which is not necessarily popular, is are you willing to give up the very thing that caused you to have the dysfunction in the first place? And most people say, but I crave this, and this. Well, no, you don't crave it. It's the bacteria and yeast, fungus, and virus in your GI tract that's actually craving it.
Hello, and welcome to this week's edition of the Green Wisdom Health Show. I'm Janet Lewis.
And I'm Dr. Lewis.
And we are going to educate you today a little bit about pain. Doesn't everybody like pain? Different kinds of pain, why we possibly have it, and natural things that you can do about it. And of course, Dr. Lewis's spin on all of it. We are going to start with some chronic pain, Dr. Lewis, for people that have it years and months in all parts of their body. So where would you like this to go?
Well, you know, the thing about it is, I don't want you to think like me, but I just want you to think. And that's why I say things in a quirky way, and people call it Stevenisms. Yeah, I just want you to think. So if you're doing something about pain and it's been there a long time, is it that you're not getting to the root cause of it? And I'm not against the noble effort to get rid of pain, but it's not an ibuprofen shortage. It's like remove the cause. Our dog got bit by a snake last night, and, you know, we did all sorts of things to relieve her pain. Short term, you know, we did some drugs for our puppy, and long term, I went and boogered my hand up, killing the snake. Had to find it. But because we removed the cause of her pain when she got bit, and we did, you know, different things. We'll talk to you about, you know, how to deal with it in a human fashion, but, you know, that wasn't chronic. That was short term. So
apparently have doctors out there that deal in nothing but pain too. I just found out the other day, like, really? There's a whole system of doctors for that?
You know, the real question I ask, which is not necessarily popular, is are you willing to give up the very thing that caused you to have the dysfunction in the first place? And most people say, but I crave this, and this. Well, no, you don't crave it. It's the bacteria and yeast, fungus, and virus in your GI tract that's actually craving it. And I'll tell you to read, you know, The Second Brain, or read 10% Human. You read a little bit in 10% Human, you'll go, holy cow, it's really the candida, the yeast, that's controlling me and causing these cravings of the very thing that causes inflammation and causes chronic pain. So in all cases, I think of any disease process, there's two common denominators in the equation, and that's GI tract is part and inflammation is part. So always think that's part of the equation.
Okay, well, here are the lists, or some of the list of chronic pain issues, which this is right up your alley, being as your chiropractor and all. Arthritis or joint pain.
Yeah, well, you know, as a chiropractor, I deal with musculoskeletal issues. But as I've said before, I would put people on supplements, and I did a lot more supplements than the normal average chiropractor. And I noticed that, well, oh my God, your high blood sugar went away. Oh my God, your high blood pressure went away. It's because we were getting to the underlying cause, and it's sometimes musculoskeletal, sometimes it's not. And I recommend a lot of books, and golly, sweet little Margaret out in California, she actually buys the books and reads them. I love her. She's 89 going on 30. One of the things you have to think about is detoxification of the liver. And sometimes your problem is so far removed that people will say, well, I want you to take away this particular, anything to do with my gut, out of the packs. And it's like, well, you know, that's the reason you have the issue, but okay, we'll take them out. And then you're going to say, I don't think it's me.
What does the gut have to do with pain? Because, you know, some people may be new to our show. I know a lot of you understand this, but if you've not done our lab or Dr. Lewis explains this to you, you're probably going, no, it's not my gut. It's pain in another limb. So how does that correlate?
Or it's my hair falling out, or it's, you know, we had a lady, what's it have to do with the guts? We have a husband and wife that just got their packs, and I was told by their preacher yesterday, Oh, she took your pack for the first time and it's the first time in years. She has not had bloating, belching, burping. I said, you're being kind and not say anything about flatulence too. So as we increase this lady's digestive abilities, we're going to decrease leaky gut, and a lot of other issues will take care of themselves, such as chronic pain. But it's always in the GI tract, because the GI tract is at least 60% of your immune system. Maybe more than that, depending on what you read.
Okay, does that go for arthritis and joint pain? Is that a gut problem also, or?
Yeah, just ask the rheumatologist. Of course, there's all sorts of arthritis. There's rheumatoid arthritis, and as a chiropractor, I would deal with osteoarthritis, and that's a kind of a structure function issue. So if my truck had its frame bent and it was wearing out the tires and the wheel bearings, you wouldn't put new oil in it. It's a structural problem. You have to deal with it structurally, but there are many, many things you can deal with it nutritionally. One of the best books, and you've got to understand, when it hurts your body, it also adversely affects your mind. It's not really the amount of pain for most people. It's the time spent with pain, and it just wears you down. And that's why I tell people, read the book Molecules of Emotion by Candace Pert. And that is an incredible book. Oh, well, let's get really bizarre here. Let's talk about why in the world would collagen stop the pain? Because we sell more collagen for women that are worried about their wrinkles, for beauty issues. And they say, I don't know, my chronic headaches or my chronic back pain has gone away. Why? Well, collagen forms a matrix, a scaffolding system, so to speak, where then your body can put down the proper bone building proteins and the minerals. So it's not just one thing. You have to look many, many steps away from the obvious pain. This collagen, I took it because, my thin skin. Well, it's way better.
Collagen everywhere on all kind of store shelves. So is that what you're talking about?
Well, yeah, sure. People say I'm taking collagen. I told one lady in Phoenix, she said, well, I'm taking da-da-da-da-da. I said, well, we've looked at your lab. It's not working. And I try to be polite, but I want to speak it in a manner where you always remember it. And I said, Kelly, honey, just because you're taking that's like going blindfolded into a homeless shelter and the first man you bump into is your new husband. And I said, I know he's a child of God and we should respect him and treat him with reverence, but he's probably not going to make good choices for you and him to be married and have a healthy, happy, prosperous life. And she said, Dr. Lewis, I got my husband out of a homeless shelter. And I said, oh, I'm so sorry. My boot is now in my mouth. And she says, no, I really didn't. I just got you. So no, all women are different. I've seen enough of them to know. And women, do you not know that some husbands are way more polite and nurturing than others? There's a difference in men. There's a difference in women. There's an incredible difference in the quality of supplements. So no, collagen's not collagen.
So when you're talking about collagen, is this a specific kind you're talking about?
Well, our collagen ultra, and it protects. It promotes connective tissue biosynthesis. So think bone and joint pain, muscle pain, supports the body's process of rebuilding cartilage, tendon, ligaments, and the fascia. It supports joint lubrication. Well, if your joints are lubricated, you're going to have less squeaks, so to speak. It increases joint cushioning, and it helps to create a normal connective tissue inflammatory response, supports healthy hair, skin, and nails. So when I put you on that for your gut, don't think it's not going to help with your hair, skin, and nails, because it will. It all works together. And let me offend you now that I'm on the track to do that. All things work for good. And that says that in the Bible. And it's like, well, if you throw it in and you have that faith, confidence, and belief, and you put action to your faith, faith without works is dead. And I'm sorry that offends a few people, but you have to believe there's something smarter than us. And your body, believe it or not, is run more automatically. We can't think it into existence. So let's make a good educated decision and then let the body do what the body does. And I hear these questions based on fear. Fear is never a good thing. Well, I won't know what did it if I'm taking more than one supplement. Let's take it easy. I said, well, let's put a gallon of gas in your truck and wonder why you can't make it to Yellowstone from Texas. It doesn't matter. How do you know if you eat a meal with 7 vegetables and a good meat? How do you know which needs to go to repair bone, which needs to go to be anti-inflammatory, which may be just cleaning out your liver? How do you know if it's going to go to lung tissue or brain tissue? We don't know. We're not that intelligent. So there's some sort of intelligence that's running this. So the best thing you can do is make an intelligent decision about what to put in and do it long term, because physiologically, it takes your body 9 months to make a baby. Don't expect that, taking a lot of supplements is going to give you free bubble love and rainbow stew within 3 weeks. It's not going to happen. I've got, like the sweet little 89-year-old lady, Margaret. Hey, Margaret, I love you, honey. She's consistent, and her lab looks better than the average 30, 35-year-old that I see. But she is consistent taking proper supplements. She has that kind of faith, but she has that kind of success leaves clues, so I'm going to keep doing it because this is creating success. So that's why collagen is absolutely incredibly good for musculoskeletal health. And the things in it is like it helps the sulfation pathway, which is a pathway of liver detoxification that I don't talk about very much. So just trust us. And yes, it's good to reduce wrinkles, but it's way, way better for internal things you don't necessarily know about.
Okay, well, what about back and neck pain?
Well, go to the chiropractor. But and I was adjusting a massive amount of people every day back when I did so much of that. But I knew even then, we can do the chiropractic structure functional thing, musculoskeletal, but you need the proper nutrients to decrease the inflammation. So yeah, that if you let that kind of pain go away, musculoskeletal pain or chronic headaches that Danielle and I talked about yesterday, and I told her over the phone what her problem was, but more important, I told her what the solution was, and she left with hope. And I guarantee you, she's going to work it out. Something that she's been missing for years. So I love this job because there's so many people. Says, you've changed the lives of my family.
When you talk about headaches, is that including migraines?
Yeah, most people say if they get a really bad headache that it's a migraine. That's not necessarily the pattern of a migraine. But from a nutritional standpoint, it's usually lack of B6, lack of magnesium, or lack of serotonin. So for serotonin, you take 5-HTP. Very few people, if any, get enough magnesium out of their diet. And the United States Department of Agriculture agrees with that. Somewhere around 40% of the people might get partially of what they need of magnesium because our food is empty. When I get a visual migraine, I take some 5-HTP for serotonin and I take some magnesium. In 30 minutes, it's usually gone. Because when I get that, I can't read and I can't drive. And Janet doesn't really like to drive. And the other thing is B6. Now, B6 is one of the things, through methylation that helps clean out the liver. Notice I keep going to the liver. If that liver's not working properly, you're going to have chronic pain. You've got to get rid of the toxins. We live in a very, very toxic world. But we're still here, so we're able to live a healthy, happy life. You might have to target the lab and target the nutrients and target your chiropractic adjustments. And you can have success. It's just give it enough time, give it enough faith, give it enough patience, and you can have victory. And I like books. There's a book called 3 Feet from Gold. Read it. Most people give up before they hit the gold.
And we do have a pain panel, right, that you put together for lab that's probably different than what people are used to running beside the natural way they go about trying to figure out what it is. Because they do MRIs and things like that. Is there a easier solution to start with, I guess maybe is what I'm asking. Where would you start with it?
The pain panel uncovers some markers that we don't get in the regular comprehensive plus hormones. And if you have chronic pain and you haven't gotten an answer, most people have already spent tens and tens of thousands of dollars and seen several doctors. And, you just have to keep trying until you find one that works, because it's not usually one doctor that has all the answers. It's usually a combination. I don't even have a problem people taking drugs. I think that should be done short term, but that's between you and your medical doctor. The only long-term drug I like is caffeine, and too much of that will inflame you too.
So I'm going to throw you a curveball here and see what you know about muscle pain all over, like fibromyalgia.
I had a lady one time, she was doing a consultation. She said, "Dr. Lewis, do you believe in fibromyalgia?" I said, "Well, yes, ma'am, absolutely." And she started crying. I said, "I'm sorry, did I say something to offend you?" She said, "No, you're the first man to ever listen to me." Usually it can be a lack of magnesium, and malate is the form that's generally most effective for that. But we're all low in vitamin D, and D has to have the proper amount of K, which is K7 menaquinone's the best, of course, or no, it's K2 actually. Well, no, it's K2 and MK7, but many people have low vitamin D, and they say, "But I'm in the sun all day." It's like, yeah, but we're so full of toxins, you don't really convert it. And if you have low cholesterol, you can't convert it anyway, because vitamin D is not a vitamin. It's a hormone, and it needs cholesterol for that biological transformation to take place. And most people don't have enough vitamin K. Now, here's the analogy that Janet and I use, and this is the one she came up with, so she's the brilliant one here. She says vitamin D mobilizes calcium like the bellhop gets you and your luggage out of your car and takes you into the lobby of the hotel. So vitamin D mobilizes calcium. If you don't have enough K to take you to the room, you and your luggage to the room, you just get a lobby full of people, or you get a bloodstream full of vitamin or full of calcium. So you have to have enough K. And I don't know if I had any influence or very much influence to this one particular company. And I said, "Well, if 180 micrograms is the critical mass on vitamin K, why in the world don't you put that in with the D? You're only putting in small amounts." And they said, "Well, because D's inexpensive, but the K is more expensive to manufacture." Well, in our vitamin D 5000, they finally put in the critical mass of 180 micrograms. And you wonder if that's not why people that are on my stuff, including me, have very, very low coronary extra K keeps the D from, or keeps the calcium from clotting or plaquing in the coronary arteries. And we have a low coronary calcium score, which increases our risk of heart attack if it goes high. So now that it's low, we can all feel better about it. So I think it's the extra K is one of the things, and I think nattokinase is another one. But
so that vitamin D with K, the super K,
yeah,
is good for fibromyalgia.
Well, yeah, that's one of the possibilities. And I always warn you, don't diagnose yourself off of anybody's list, whether it's mine or Janet's or anybody else's. But that's a definite possibility, if not a probability. That's really one of the things that could work.
Eating anti-inflammatory or eating inflammatory foods is probably another one that does that, right?
Oh, God, yes. Seed oils are making us dumb as a sack of rocks, and it's creating horrible, horrible inflammation. For example, the average American eats about a 20-to-1 omega-6 to omega-3 ratio. It should be 4-to-1, and there's good omega-6s, and there's a lot of bad omega-6s. 20-to-1 versus 4-to-1, which is ideal, and that's why the omegas are incredibly effective, and they're not all the same. We've got a test that can prove it, but we try not to do that one.
Yeah, the omegas are different, and ours have been out of stock for about a month and a half. And thank you all for hanging in there with it. You know, the reason why it's out of stock is because they keep getting in contaminated issues or
Or
contaminated problems
yeah.
in the visual. So they will not process it.
So other companies just take it batch and encapsulate it, and you're taking it. If it's from Amazon, I shouldn't say that, but there's so much counterfeiting going on, and we deal with companies that will not allow that to happen.
Right. That's the difference in quality, which people talk about. It's like, well, why is your stuff higher? Well, the quality in it is different, and it's tested. It's not just put out and hope you live.
And most of the time, that's not even true. That's a person's perception of it. I see people, well, you know, you're taking $500 a month worth of stuff that's not working. And holy cow, your liver enzymes have gone to heck in a bucket. Your immune system, your neutrophils and lymphocytes are terrible. And you're spending $500 a month where you really need to be spending $250 or $300 with me for the better quality. So sometimes that's a bad perception that's not really true. So it's what you put in your mind becomes true for you, even if it's not really, really true. So be careful what you think.
And I also wanted you to talk about, we have another product too that's called collagen factors.
Yeah.
Different from collagen essentials.
Yeah.
Or it's collagen ultra. So we've got a powder collagen that's more like for skin, joints, pain. And these collagen factors are more for rebuilding.
Yeah, and to teach and to give your body the raw materials to build it itself. So, yeah, they're both real popular. I don't know which one's best, so I just take them both. But
I take them both because they make my nails strong, one without the other.
But for those of you that's not seen Janet, she's very, very uncommonly beautiful, and she looks about 15, 20 years younger than what she is. And I'm sure it's not just the supplements, because once she puts a happy thought in her head and has a radiant smile, that makes all the difference. And again, it goes back to your spirit. So that helps a lot. It has certain so-called beauty proteins like orthosilic acid, and it nourishes the body's so-called beauty proteins, which is collagen, but elastin and keratin. That's very important too.
So some of you that are having chronic pain, and I'm sure you know what it feels like, but it's the aching and burning, shooting pains, squeezing pains, throbbing. And over time, if it's not dealt with, it leads to anxiety and depression, which a lot of people, once they're in that, all they want to do is sit and not move.
Right.
Do you suggest they stay immobile that way and not move? Does that help it get better, Dr. Lewis?
No, moving is living. So, no, got to move. Get up off the couch. I had a lady says, since my husband got on this stuff, he's taken that womanized or treated wood that's been there for 3 or 4 years, and he finished building the big deck off the back of the house. I said, well, tell him when he stops moving, have a cold beer and toast the fact that he had the energy to do that. I think that was that last week's podcast on energy.
Right. I guess so. I don't know.
we forgot our memory pill.
I think so. Anyway, so there are some over-the-counter products that most of the doctors will tell you to take for pain. And I want Dr. Lewis to tell us if he has something natural around that they could take, or maybe they don't make their livers more toxic, like you said. A lot of people get put on antidepressants because they're in so much pain.
And if you have thoughts of hurting somebody or hurting yourself, by God, you ought to take that stuff until you can find the underlying cause. We work with a lot of medical doctors and nurse practitioners, physicians, assistants. We're all trying to help people. We just do it in a slightly different manner. There's nothing wrong with drugs. Now, I do that very, very conservatively, but still, they do have their place. So don't push out the medical profession because they can save your life and sanity. But yeah, the drugs can have a very bad detrimental effect on your liver and increase the detoxification. Tylenol's probably the worst, but I could be wrong. And so there may be a methylation problem, and the internet has been scrubbed somewhat, but used to you could learn about improper methylation, and that would be our B12 methyl, which has the B12, the B6, which creates energy, and the folate, the specialized folate, if you have that genetic SNP, and the folate is 5-methyl tetrahydrofolate, and it's like, you've got to have that. Janet can tell you the day I don't take it. It makes that much difference in how I feel and how much energy I have.
And one way you'll know if you're making your liver upset is if you're waking up between the hours of 1 and 3 in the morning, because that's when it's trying to regenerate.
Yeah.
And if a lot of people can't tell you the amount of people that go, I take a Benadryl before I go to bed. I take an Advil before I go to bed. It helps me sleep, but I'm awake during those hours.
Sleep is an issue, but I don't need anything to sleep now, and that hasn't always been true. Once you clean up your body and feed it correctly, you don't really necessarily need that. And another thing Janet hadn't got to, or maybe will or won't, bacteria can produce toxic products, which are called inflammatory interleukins. And this is from Journal of Immunology. These are not my opinions. This is coming from research. And I mentioned B12. Did you know I read a study, some research the other day from pediatric radiology, and it showed PET scans of little babies that were born of vegan mothers, and they had a severely shrunk brain because they were lacking the B12 that comes from the meat products. And once they were administered the right kind and right amount of B12, the brains came back to normal. Of course, the omegas have a lot to do with the brain function too, the DHA in particular.
And amazingly, stress can play a major role in chronic pain. So you need to try to reduce it as much as possible.
Yeah, but is that chemical stress, like the place had just been fumigated for roaches, or is it the stress of a boss that doesn't know how to be a boss, that's a narcissistic, stress-producing boss? Is it a bad marriage? Is it financial issues from this time in American history where there's no inflation, says some people? Is it chemical? Is it? I've seen people work out too much. Our grandson's guilty of that when he's getting first and second place in half marathons, but he overworks, and that can cause chronic stress too. So figure out where your stresses are and choose to live in joy.
And actually exercise, like walking 30 minutes every day, may help reduce your pain. I can't tell you, we went up to Sam's here where we live yesterday, and I can't tell you the amount of people riding around in a little buggy getting food in their cart. And those, I get some people are handicapped and can't walk, but, there's a time to be walking also. So maybe trying to make an extra effort to actually move would help.
Yeah, it doesn't have to be a lot, just some, because the body, that helps the muscles move and helps massage the lymphatics, which helps get out some of the toxins. It's very important to move. You were designed to move, even if it's just a little bit. Challenge yourself to do a little bit and then do a little bit more the next day or two.
Yeah, and there are things like acupuncture that you can do. Aromatherapy with essential oils helps. They're better for you alternatives. How's that?
Or possibly less damaging.
Less damaging. Biofeedback.
Yeah.
Hypnosis.
If you don't get good biofeedback, get your spouse to say nice, uplifting, spirit-building comments, and that helps a lot.
Mindful training, which teaches you how to calm yourself.
Just go to your chiropractor. Most chiropractors are well-versed in most of these more natural methods.
That's true. And music, art, or pet therapy. So
yeah, there's nothing like the music from the 70s, late 60s and through the 70s. Yeah.
So, Dr. Lewis, sadly, we've come to the end of our show here. I'd like for you to be able to give someone hope about pain and maybe take some action steps of what you're suggesting.
Well, if you want to take an action step, you have to, most people in America need to lose weight, about 70% of us. And it's hard to lose weight when you have an overactive knife and fork. People say, but it's my thyroid. Well, we can give you the supplements that can stimulate the thyroid. You need to stay away from negative people because they have a problem for every solution. They shoot you down with what could go wrong rather than what could go right. And, I go to the Bible for that. And I'm sorry that offends some people, but it shouldn't. If it takes you longer to rest to get over what you did than it did to get tired, you really need to check us out and get your lab work. If you think that Jack in the Box, if you remember Jack in the Box, but you really want Jack in a bottle, you have an issue. So alcohol's not a good solution. And, we can all be better. We want to influence you. We want to inspire you and just let you know there is hope where you can have a smile on your face. And we hope that you will have a great day and then some.
And if you would like to get started with feeling better and haven't gone here, have never been to our place or need to start again, please go to greenwisdomhealth.com, fill out the health survey. Dr. Lewis will call you and talk to you about what you filled out and see how we can best help you start having a life worth living. We hope you have a blessed week, and we'll be here next time on the Green Wisdom Health Show.